Hey everyone, it's Dr. Z here. I wanted to talk a little bit about the options for skin resurfacing per se. So who's a candidate for skin resurfacing? Well, really anybody that has a skin, right, over the age of 24 when skin starts aging. However, there are different options. So with lasers, if we're talking about lasers, we've got two categories we divide laser skin resurfacing into. One is a full field and the other one is a fractional. Full field has the ability to do a very, very aggressive treatment, but leaves no unspared areas in between. And the issue with that is that there's a way higher risk for complications, significant complications, and kind of a wind-blown appearance. And that's why that's fallen out of favor. With a fractionated handpiece, seeing these micro channels going into the skin, but leaving areas of uninjured skin in between, that decreases the healing time significantly. Even though with the skin resurfacing, you should expect anywhere between 5 to 7 days, and also decreases the risk of complications dramatically. So the options we have in the clinic is the Alma Hybrid, which is a CO2, a fractional CO2 that you can use in many different ways. It's got many different little textures that it can be used in certain areas, and it can be customized according to the treatment area. The beauty about this machine is that it also has combined in the same treatment the ability to add what's called a 1570. So if your Alma Hybrid CO2 is the resurfacing component, then the 1570 acting deep underneath the CO2 is your shrink wrap, right? So that's for laxity, any gels, the cheeks coming down, so without adding injectables into the picture. So that's your CO2 1570 Alma Hybrid. Why I love it and never had a CO2 before is the treatment is so precise, so beautiful, almost mesmerizing to watch, that we know, even if we treat really aggressively, what the downtime is going to be, because the delivery of energy is so specific and so accurate, right? Our other option for skin resurfacing is called a fractional erbium. So erbium, again, can be done full field and it can be done fractionally. So Alma has a handpiece or has a resurfacing component called Superb, and the ERB is for erbium. So erbium is a less aggressive form of skin resurfacing, really for the person that has very, very dark skin type, or is not prepared to prep their skins beforehand, really just wants to dip their toes in. But truly you can get remarkable results with the erbium. Erbium is not as aggressive as CO2, so that's where you should see the difference. If I punch you lightly, that would be erbium. If I punch you really hard, that will be the Alma Hybrid, the CO2 1570 combination. So you got to think about downtime in terms of the energy that is delivered and healing as a response to the energy that is delivered. So those two are the components that we use for skin resurfacing in the laser category. There are non-laser skin resurfacing things that we do in the clinic too, such as chemical peels, microdermabrasion, skin health with ZO is a skin resurfacing component, but everything is just a very light touch or a very light punch, a harder punch, a super hard punch, and a super hard punch. So you got to think about energy delivery for healing. And if we're talking about energy delivery, either through something topically or with a laser light component. I hope that helps clear some of the questions. Do I do erbium? Do I do Alma Hybrid? Do I do Alma Superb? Do I do a deep frac? Do I do a micron peel, which is really just blowing over the top of the skin with an erbium laser? So great for very, very minimal, like almost like a microdermabrasion on steroids, right? So if you've got any questions, please feel free to reach out to us. You can book these treatments with our consultations. However, we always suggest to do a consultation to make sure the treatment that you're choosing is actually the treatment that is going to target your concerns very specifically, also with the least amount of risk and the highest amount of outcome.